the first HIV cases identified in Uganda came from Rakai district, where I'm born. And as a kid, I have seen the real effects of HIV. I had to attend so many burials, including my relatives. That was a very important motivation for me to try and get into this HIV/AIDS research area with the purpose of trying to see if I could make a difference for my people with regards to the HIV epidemic.
Rakai Health Science Program motto is improving health through research. So over the years, we have looked at a number of interventions to try to evaluate where they have an impact on HIV transmission. Since 1988-89, we have been on a roller coaster of new exciting research work that has got us to where we are.
And we set about trying to do a community-based survey in Rakai. We started off in 21 villages with a team of only 8 people with one borrowed truck from the AIDS control program of the Ministry of Health. And that's how it all started. And the reason we're here in the Milano Inn in Chiotera is because this is really the first headquarters of the Rakai Health Sciences program. The questions we were trying to answer was how badly affected is the general population of Rakai by this HIV epidemic? What proportion of people have it? Is it more among the young? Is it among the old? Is it spreading mainly sexually or potentially through other routes? Out of these questions was born the Rakai Health Sciences program.
The activity going on in this venue is the survey activity. This is the activity through which we collect the data that we use to answer the objectives of the Rakai Community Code study. At the same time, we have other people that have come to obtain services that are attached to this study, and the major service they've come to obtain is medication.
Tusobola okufuna obujjanjabi abali abalwadde bayisizza ekizindaalo kya mugaso okuba okusobola okutegeera oba balamu oba tebalina bulwadde.
This is a very difficult task, usually, to leverage the funds to run these clinics here. We usually don't have a line item in our funding to actually run these clinics. It is very difficult to do research activities and ignore the services that people need. People out here in this community have so many health problems.
When I first joined the program, Rakai was providing basic HIV care services, and this was mainly treatment of opportunistic infections. And probably that had been limited to that because antiretroviral drugs were very expensive and people were basically buying out of pocket. As a program, we could not afford to buy ARVs, but with funding from the President's Emergency Plan for AIDS Relief, we were able to start providing these drugs free of cost to the patients.
My situation was not okay. It was in 2006. I started feeling lazy. I could not wash clothes. I could not walk a long distance. I feel better. It is because of these drugs I'm getting. If the Rakai Sciences program was not here, I could be in grave at this time.
We and other groups had noticed that men who were circumcised had lower rates of HIV infection than men who were uncircumcised. The problem was that the evidence that we had was insufficient for policy and for programs.
Two other groups had the same idea that we did of testing male circumcision for HIV prevention.
And so we had to do a randomized trial, which is like an experiment, where half the men were offered immediate circumcision, the other half circumcision was delayed for 2 years. And then we follow these men to determine their rates of HIV infection.
We were absolutely astounded by the success of this intervention, which reduced HIV acquisition in men by over 50%. And these results were completely consistent with the other two trials in Kenya and South Africa. And to have a slam dunk like that for 3 randomized trials, which are the gold standards of testing prevention methods, it was so reassuring.
You know, when our results came out, you know, we thought, oh God, this is amazingly good. It's a home run, because we really had spent quite some years without a very successful intervention. So when this came up, we said, oh, we thought tomorrow people would just jump onto it.
It's been hard to change policy because it's a whole new paradigm. We've never used surgery to prevent an infectious disease. Policymakers have to take some time to really wrap their minds around it. The other problem is you've got a huge problem of training personnel to do the surgery, setting up safe facilities, providing the supplies. So it has taken longer than I would have liked to see these programs emerge.
There are some countries that have been very, very open to male circumcision. But in a lot of places, changing programs is a bit like trying to move the Titanic. Bureaucracies move slowly. But the bottom line is, in places where it's being provided by our colleagues in South Africa, our colleagues in Kenya, here in Rakai, men are lining up. So if you give people the opportunity, if you give people the services, it's amazing. Cultures do change once people see that there's a real advantage of a certain action on their part.
The research that's being done in the Rakai program in southwest Uganda, a very rural place, is state of the art. It is incredible to go there and see the commitment of the people who work there, the level of skill and quality they have, and the care they take with the data and in carrying out the research. It's really a model.
From its very beginning, the Rakai program has always worked to build up a very strong group of Ugandan researchers, young researchers. Very importantly, many of them go for training at Johns Hopkins for master's degrees and doctoral degrees, and the great majority come back to Rakai. There is very little brain drain because the Rakai program gives them a place with a career trajectory. The other thing that is really important to realize is that among our colleagues, there isn't anybody whose family hasn't been affected by HIV. For them, this is personal. HIV is not an abstract issue. It's a personal issue. They're trying to fight an epidemic that has profoundly affected their families, their communities, and their country.